Okay. So good evening, one and all. I, Dr. Madhura Kelkar, I welcome all of you on behalf of Pune Obstetrics and Gynaec Society for our very, over the edge or cutting edge webinars, which we conduct every Tuesday, 4 to 5 p.m. And this being the breastfeeding week, we have it with none other than the Foxy Breast Study on the Female Breast Committee. And we have all the important members of the breast committee, including the chairperson and all the other pillars of the breast committee. So I welcome all of you and thank all of you for joining our webinar. Now I request Dr. Meenu Agarwal ma'am, who started these webinars, to give her address.
Thank you, Madhura. Thank you for this kind introduction of the cutting edge webinars, which we have been hosting for the last 6 months, every Tuesday, 4 to 5. And thank you, Aarti Madam and Meenakshi, for carrying it forward when I started it, when they took over as the POGS secretary and the president. And this particular webinar is mainly conducted, as Madhura mentioned, with breast committee. So thank you, Charu Lata Bapai, for accepting this association of POGS with breast Foxy study of the breast health. I also am very happy to have Dr. Manjula Appadurai here, Dr. Anita Rajoria here, Dr. Nirja Puranik here, Dr. Shilpa Shirsagar here, and Dr. Taru Chaya here on this platform. So this is a very, very nice faculty, and Dr. Manglavani, I think she'll be joining. This is a very nice faculty we have for today. And of course, we always have huge number of delegates, participants, colleagues who are always waiting for this cutting edge webinar every week on Tuesday. So thank you very much. And thank you, Charu, for accepting to associate and also to be the guest of honor. So thank you very much. And Madhura, we can take it forward from here.
Thank you, ma'am. Now I request Dr. Aarti Nimkar madam, who is the president of POGS, to give her address.
Yeah. Good afternoon, everybody. I welcome you all for this webinar of the cutting edge. And today we are having the lactation and breast committee members for this as a speaker and as a chairperson also, and our own Vijay member and breast committee person Charulata is a guest of honor, and also she's chairing the first session of the abnormal discharge, nipple discharge. By the on this topic, Anita Rajoria is going to speak, and chairpersons are the Taru Chaya Bansal and Charulata. And second talk is also by the breast lactation committee person who is a very good doing the very good work in this committee since long back, and she's our own executive vice president Mangala Wani. She's going to speak on the close the gap. Let us see what she's talking on this topic, close the gap. And for her, the chairpersons are the Neeraja Purani and Shilpa Shirsagar from the Pune only. And we are having the this Foxy committee conference on the 10th and 11th on the breast and lactation. So I request all to join to us, because we are thinking of making it online also. So please join in the maximum number. Thank you very much.
Thank you, ma'am. So before beginning the webinar, we would like to take blessings of the Almighty by having a prayer song.
Shubham kurutvam kalyanam arogyam dhanasampadah. Shubham kurutvam kalyanam arogyam dhanasampadah. Shatru buddhi vinashaya Deepajyotirnamostute. Deepajyotirnamostute.
Thank you. So let us begin. We have a very special guest of honor today who needs no introduction. She's everyone's favorite. She's my mentor and she's present for most of the webinars, but today she has a special place in today's webinar. So I request Meenu ma'am to introduce Charu ma'am.
Oh, please.
अभी चारू को मैं कैसे इंट्रोड्यूस करूं? चारू is lovely, she is beautiful, she is brainy, and she is very, very, very hardworking. So here we have, she is the chairperson of the study of the breast Foxy committee. She has been the clinical secretary of POGS and she has held many posts. She has done lot of work in endoscopy, in breast health, and in many other avenues as a Foxian. I remember when we did our first annual CME, the installation CME, for the first time we had a room for breastfeeding. So even the our younger colleagues who had small children and who were breastfeeding could attend the meeting with their little ones and could go to the breastfeeding room and breastfeed. So this was all Charu's idea. So Charu, thank you very much. Thank you very much for being there. You know, so you don't know what I mean. So thank you, and we are really honored to have you as the guest of honor today. The POGS is honored to have you as the guest of honor today. Thank you very much.
Actually, thank you so much, Dr. Meenu. I really don't know from where to start essentially because I'm just simply overwhelmed. जब अपने ही घर में अपने को किसी pedestal पे बिठा दे तो थोड़ा अलग लगता है and that is exactly how I'm feeling currently because I am so happy to be with friends and family. Dr. Meenu Agarwal, I think we both started our endoscopy careers almost simultaneously. But she far outraced me with her skills in laparoscopy and her skills in IVF and her reaching the pinnacle of success by becoming Secretary General of ISG. Dr. Meenu, I wish you all the very best for all your endeavors and we are sure we are going to see you in a leading position very soon. So firstly, I would like to thank you for considering my name as your guest of honor. As far as Dr. Aarti and Dr. Meenakshi are concerned, they are also again family. It is our own very POGS and with whom we are doing our breast health and lactation summit on 10th and 11th of August. And most of our faculty who are present here today are going to be our esteemed, speakers in that particular conference. And so I welcome Dr. Manjula, Dr. Neerja, Dr. Taru, Dr. Shilpa, Dr. Mangala, and I hope that Anita can also join us in this particular live conference that we are going to have. I think that I would also like to extend my best wishes to Dr. Anita for her future endeavors. She's an esteemed speaker for today. So actually, it is the World Breastfeeding Week and the entire breast committee is so busy with so many activities. But when we got a call saying that Dr. Meenu wants to associate with us and have her webinar with us, we jumped at the opportunity and all my fantastic committee members who do amazing work at one phone call, all of them were with us. And Madhura, thank you so much for spelling my or saying the name of my committee in the perfect way. We are trying to shorten it. We have put forth a proposition to our president, Dr. Jaideep Tank and Dr. Madhuri Patel, madam, to shorten our name so that everybody will say it in the picture perfect way because it's rather complicated study on female breast committee. So that is how it is, and I think that this year's theme being closing the gap, Dr. Mangala Vani will be speaking about it, and the topic of abnormal nipple discharge, which is again a very, very common problem which we see in women at many ages, at all ages rather, is going to be covered by Dr. Anita Rajoria. We are going to have Dr. Manjula, Dr. Taru, Dr. Shilpa, and Dr. Neerja as our esteemed chairpersons for this particular webinar. So once again, I would like to thank Dr. Meenu Agarwal and POGS, especially Dr. Aarti and Dr. Meenakshi, for inviting me here in my own house in a special way, and it means a lot to me. Thank you very much. Thank you so much.
Thank
It's
you.
an honor to me.
Thank you, ma'am. So let us start our first session, where Dr. Anita Rajoria would be speaking on abnormal nipple discharge. I would request Dr. Meenakshi Deshpande, ma'am, who's the Secretary POGS, to introduce both our chairpersons.
Yeah, thank you, Madhura. And I welcome you all as a Secretary of POGS to all this august audience, and the welcome to all the faculty from all over India from this female FOXI study of female breast committee. And I would like to thank Dr. Meenu for reminding me yesterday that yes, we have got a program to do tomorrow, and on a simple one phone call we really slashed out the program in just 3 hours yesterday evening. And today morning, Madhura has taken over. And a very nice program you have charted out, Madhura and Charu. So it was a very good thing for us, also for POGS, to get this program on dais. And I hope we have spread this to many people around. And it has gone all over FOXI groups also, because I have personally sent it to many FOXI groups all over India. So I hope this will be a very welcome and a welcome this webinar in that lactation week, in which we are celebrating lactation awareness. We are studying the importance of breastfeeding. We are always giving out the messages of breastfeeding to all our staff, public, layman, persons, and all the patients which we are facing. So now we will start with this abnormal nipple discharge by Dr. Anita Rajoria. So I would like to introduce the chairpersons. The first chairperson is Dr. Manjula Appadurai from Pudukkottai, Tamil Nadu. Is she there on the dais? Is she there in the webinar?
Yes, ma'am, she's there.
Manjula, she's there now. Welcome, madam. Thank you. So she's a South Zone Coordinator of Breast Committee FOXI in 2023. She was the Master Trainer of RAC Project FOXI. She's received the Appreciation Certificate from FOXI for preventable cervical and breast cancers. She was awarded the Muruthuva Nachathiram from Honorable Health Minister on 31st July 21. She was the Vice President of Menstrual Hygiene Management Consortium, and she has conducted Youth Mela programs for school and college students in 2016 on Save the Girl Child. She's conducted various health camps for women regarding disorders of the breast and gynecological diseases. And she was the speaker in many national conferences organized by FOXI. I would also now welcome the second chairperson, Dr. Taru Chaya. Welcome, madam. I can see her, yes. Consultant and Director, Bansal Hospital, Shamnagar, Jaipur. She was the past Secretary of Jaipur Obs and Gynae Society 22-23. She was a State President, IMA Women's Wing. She was the Honorary Secretary, Narchi State Branch, Rajasthan, a co-convener of AMWI Jaipur chapter, a faculty at RCOG, and member and chief lead of the Breast Committee, FOXI. She was the Master Trainer of FOXI RAC, Master Trainer of Manyata, Master Trainer of FOXI HPV vaccination, awards, FOXI Achiever Award, and FOXI International Achiever Award. She's also got 2 publications in IJSRA in 22 and 23. We welcome you, madam, to our webinar here, and I request you to speak a few words.
I'm very happy to be here along with all you breast committee members. I love you all. And during this breast week, I'm seeing too much active participation of from all over India, FOXI. It's very good and very, it's becoming very difficult to make results out of it. I know Dr. Charu is going to have a hard time now. Welcome you all.
Warm good evening.
Thank you.
It's a greatest pleasure for me to participate in this great event, being in the August first 7 days of the World Breastfeeding Week. We are celebrating this Breastfeeding Week, and the WHO and UNICEF has announced this. The logo for this year's World Breastfeeding Week is Closing the Gap. And this topic is rightly chosen by the Pune Society for such a wonderful webinar this day. And the golden hour of breastfeeding has to be very much initiated by all our societies in instilling this golden hour hospital policy in all our hospitals. Thank you.
Thank you, madam. Now over to Madhura for who will be introducing the speaker.
Yeah.
Yes, Manjula ma'am will introduce. the
Yeah,
speakers.
okay, yeah.
Now I invite Dr. Anita Rajoria. She has held various positions: North Zone Coordinator, Breast Committee, FOXI, President ISOPAP Delhi, President Delhi Gynec Forum, Chairperson Environment and Reproductive Health Committee, ISAR Delhi, EC member, NARCHI Delhi, past member, Reproductive Endocrinology and Infertility Committee, AOFOG, past executive member and chairperson, Adolescent and Reproductive Endocrinological Committee, AOGD, advisor, Society of Menstrual Disorders and Hygiene Management. She is member of IMA and various other societies. She has won many awards: APJ Abdul Kalam Achievers Award, Rashtra Gaurav Saman Awards, Wonder Foxian Awards, Inspiring Gynecologist of North India, Foxy Friends Felicitations, Professional Excellence Awards, Chikitsa Ratan Award, Humane Award, Women Achiever Award, Gaurav
Thank
Saman.
you, Mandula. Thank you.
So much awards to her credit. I welcome Dr. Anita Rajoria to speak on the abnormal nipple discharge, which is a very important topic. Over to you, Dr. Anita.
Thank you, Manjula and Taru, for that wonderful introduction. First of all, my thanks to Aarti ma'am and Meenakshi ma'am for giving me this opportunity, along with my own dear Dr. Charu, who has given me this opportunity to speak in front of this August gathering. First of all, congratulations and best wishes for the ongoing breastfeeding week. I know breastfeeding is such an important topic and closing the gap is important. But before, advising these mothers, we should all be aware as obstetrician gynecologists, because we are the first contact of all pregnant mothers and women as such, that what is the true breast health and what is normal and abnormal nipple discharge. So thank you for giving me this topic to elaborate upon. So abnormal nipple discharge, I'll be dealing what is normal, what is abnormal. So first of all, my regards to all of you, and I seek your blessings for Chairperson Environmental Health Committee, FOXI. This is the only green slide you will find the whole PPT, because rest of the pink denotes it is all dedicated to our breast committee, FOXI. So the breast is an organ of growing concern. We all know form, function, and pathology. They are the major concerns of medicine and society. As mammals, the breast nourishes the young. It gives the contour, which seeks special attention. Obstetricians, we seek to enhance or diminish its function as per the condition of the patient. And as gynecology, the appearance of inappropriate discharge worries us, as it could signify serious disease. Now, we must all be aware of the anatomy of the breast. I think Mangalaji will also talk about it. Breast is divided into 15-20 lobes. It has fibrofatty tissue interspersed with glandular tissue, which is connected to duct system. And these lactiferous ducts, they drain a lobe. And the lactiferous duct, they themselves are lined by cubical epithelium. And near the opening, they become stratified squamous epithelium. Now, each duct divides and subdivides and ultimately ends into the alveoli, which are the milk gland, and they are lined by single layer of milk-secreting epithelial cells. And each alveolus, it is encased by crisscross mantle of contractile myoepithelial cells. And there is a rich capillary network as seen in this diagram also. Now, regarding nipple discharge, the discharge is a true discharge. It is the direct drainage from the mammary duct or ducts. It may be multiple ducts also, which appear on the surface of the nipple. Initially, it was said that nipple discharge may imply, underlying tumor infiltration into the ductal system. And so many females, unfortunately, had mastectomy because of just nipple discharge, because we did not have very good diagnostic modalities at that time. But now we are more rational and more conservative because we have good diagnostic facilities around. Now, nipple discharge. What is nipple discharge? When the secretions from a non-lactating, I underline non-lactating breast, they are abundant, either abundant or persistent enough to discharge either spontaneously or even with gentle manipulation from the duct orifice. So the discharge can be lactational, which is physiological, and sometimes it may be pathological. We will deal with it in our forthcoming slides. The discharge may be unilateral or bilateral, and it is the third leading breast complaint with a prevalence of around 5 to 10% in our females attending OPDs. And 7 to 13% of these clients can have underlying malignancy. And please note that nipple discharge can be an early warning sign of breast cancer. So what is normal? Again, I am reiterating that milk starts let down in late pregnancy sometimes. After childbirth is of course normal. During first weeks for feeding of newborn, following breast massage, even slight massage sometimes can have normal nipple discharge, or patient has used breast pump for any reason, or the breast has been compressed for doing a mammograph, it may induce slight discharge in women of reproductive age. Now, there are various types of nipple discharge you can encounter in your clinical practice. It can be milky discharge, which is due to lactation or pregnancy as such, or there may be galactorrhea. Galactorrhea may be caused by stress, any kind of or exercise. Any exercise which involves chest muscles can induce galactorrhea, or it can be secondary to drug intake. Which drugs will cause galactorrhea? We all know oral contraceptives, H2 receptor antagonists, phenothiazine derivatives, SSRIs, other antipsychotics and antidepressants, opiates, antiemetics. We all know, like metoclopramide, danazol, and antihypertensive. So we have to be very, very careful in eliciting history while a patient of abnormal nipple discharge comes to you. And there may be certain underlying medical and surgical disorders like hypothyroidism, pituitary adenomas, hypothalamic lesion, herpes zoster of chest, underlying bronchogenic carcinoma. It can also cause abnormal nipple discharge. Now, I talked about milky discharge. Now, bloody discharge or serosanguinous discharge, as we call it. It can be unilateral or it can be bilateral. Bilateral are usually due to sometimes in pregnancy or lactation, but it will settle down. While unilateral is, something which we need to pay attention to because it can indicate intraductal papilloma, ductal carcinoma in situ, or any other kind of intraductal carcinoma. Clear or watery discharge may indicate ductal cancer or ductal ectasia. We'll discuss these in forthcoming slides. It can be purulent, of course, abscess we will discuss, and underlying tuberculosis. This is very, very common. I've seen few cases of breast tuberculosis which have presented with discharge from the nipple. Or it can be simple brownish green discharge which suggests fibrocystic disease. Now, sometimes the surface looks like this and there may be discharge from the surface. So these are the skin lesions which may cause like eczema, Paget's disease of nipple, or chancre as such. Now, what do you do when you find a patient who has come to you seeking advice about nipple discharge? Take a detailed history, sit with her, take her menstrual history, rule out pregnancy, what is her age, is the discharge unilateral or bilateral, since when she is experiencing this, is it spontaneous or it is caused by some other activity? That means it is provoked. What is the color of the nipple discharge? Is she taking any history of medications is there? Was there any chest trauma? What is her hormonal status? I talked about because hyperprolactinemia and hypothyroidism indirectly can cause galactorrhea. Is there any history of breast and ovarian cancer, personal or family. All these become very, very relevant. Now, what are the red flag signs? You need to be very, very careful when nipple discharge is unilateral, it is bloody, serous, or clear discharge. So, you should not feel relaxed that it is a clear discharge. It can also be ominous. The discharge is happening spontaneously. It is persistent. And it is involved with either skin changes or nipple changes, or there is an underlying lump. These are, certain signs which may feel that you need not worry a lot if the discharge is bilateral, milky, non-bloody, greenish or yellow. So it can be associated with some benign conditions. And what you need to do further to investigate the patient, please do her serum TSH, thyroid profile, and estimate her serum prolactin, rule out pregnancy, do ultrasound, MRI for pituitary, and accordingly, you can treat the patient as per the cause. Now, how will you investigate a case when a lump is present? We all have been taught that whenever a lump is there, we have to do triple assessment. What is triple assessment? You clinically assess the patient, take history, do good examination, do radiology, either by ultrasound in younger patients, mammography is in middle-aged, contrast and enhanced MRI, ductography, ductoscopy as per the scope of your organization. And histology is essential. And now it is no more FNAC. You are either doing core needle biopsy or a vacuum-assisted breast biopsy. But if the lump is absent and the discharge is clear or serosanguinous, think of intraductal papilloma, think of ductal ectasia, and please rule out underlying malignancy. So radiology comes to your rescue. It may be ultrasound, mammography, ductography, contrast MRI, or ductoscopy as such. So which test to be done? Mammography. It is the standard imaging technique. We all know microcalcification are highly sensitive to malignancy. But as far as nipple discharge is concerned, the sensitivity is low. Now, we are using ultrasound with high frequency transducers to rule out any underlying pathology, especially in patients with nipple discharge, so that we do not miss anything. And you often find duct ectasia, which has irregular duct margins. There is duct wall thickening, hypoechoic mass may be there with acoustic shadowing. These all suggest malignancy. So you have to look out for these features. And detection of ductal carcinoma in situ or invasive carcinoma has a sensitivity and specificity of 56 to 75% respectively. And Doppler ultrasound is important because it can differentiate intraductal nodule from sludge by showing vascularization. Contrast MRI is done in patients with suspicious nipple discharge who have a normal ultrasound and mammogram. You have seen a patient of nipple discharge and on ultrasound and mammogram, you have not found any abnormality, then you can subject her to contrast enhanced MRI because it has sensitivity of 97% and it will detect cancerous lesion if they are very small ones. It allows good visualization of both breasts, including the retroareolar region. This is also important, and you can differentiate benign from malignant lesion. You can see multicentric disease. So it is a better tool. And even in the deepest area of breast, you can find small lesions which may remain undetected by ultrasound or mammogram. And during planning of surgery, of course, you do preoperative MRI. Ductography was done. You do just put radiopaque dye in one or more ducts and you take the X-ray. But it is difficult because it is really challenging to cannulate the particular specific the ductal opening which is having the problem. The sensitivity is 76% and 11% specificity is there. Now it has lost its favor because CE contrast and enhanced MRI has become more prevalent. So it was initially done. You may see that it was used in around 2000, year 2000, and you found filling defects, dilatation, cutoff. There is sudden cutoff of the duct. This suggests that something is underlying that pathology. And you may find normal ductography also. So regarding ductoscopy is concerned, you can directly put the scope into the, it is a microendoscopic procedure. You can visualize the abnormalities in the specific ductal system. And what is the advantage? You can get the access to the tissue directly, and you can surgically excise or take a biopsy for histopathology. Usually it is an office procedure which can be done under local anesthesia. What is the role of nipple discharge for cytology? Is it of any use? Yes, it should be done, but it has high false negative rate for malignancy. So we have to be very careful. Vacuum assisted excision is the new tool. It's a new kit which is available for diagnosis for us. The common conditions which we find with the nipple discharge are duct ectasia. It is just a dilated duct which is engorged with breast secretion. Infection is there. It can lead to formation of retroareolar abscess, fibrosis, and periductal mastitis and all that. So we must know these conditions. Smoking is usually implicated. It is the predisposing factor for duct ectasia. Investigation you will order for ruling out duct ectasia is mammograph, cytology of course. And how do you manage them? Control infection by aspiration and antibiotic. If abscess formation is there, you have to either do repeated aspirations or you have to drain. And severe discharge or recurrent sepsis may call for mammodocectomy. That particular duct has to be excised. So this is the duct ectasia, how it looks on ultrasound. You need to rule out the malignancy, and sometimes you need excision of the mass as such. But in elderly, sometimes you can leave them alone because they are the self-limiting conditions. Intraductal papilloma, yes, it is a benign tumor which is found in the breast duct, but it has a risk of malignancy because it is associated with 8% risk of atypia, ductal CIS, or carcinoma. How the patient will present to you? Either with bloody or clear nipple discharge. So you can diagnose either on ultrasound, MRI, or of course, ductography. Please rule out malignancy by core needle biopsy or VAB in these particular cases. The treatment is of course excision and doing the histopathology. So this is the intraductal this thing. And how you treat is by intraductal malignancy. If you find, you either treat as by surgery or you do total subareolar duct excision, especially, and or you can, what you can do is microdotectomy, as I have already discussed. Vacuum assisted excision can also be done. But the problem with major, surgery is patient is unable to breastfeed at that particular period, and there is maybe loss of nipple sensation and retroareolar necrosis may be there. Fibroadenosis is another problem which can be either patient may present with lumpy breast, or they can present with nipple discharge also, which is usually greenish or yellowish. There is not much association with risk of malignancy, but we have to keep the patient under follow-up. So treatment, we all know, hot and cold compresses, comfortable bra, salt, fat, caffeine, all these have to be avoided. Good lifestyle, exercise, all these things are important. And medical management mainly is giving painkiller as NSAIDs, OCP, progesterone, even danazol has helped. Previously, we were using evening primrose oil, also SERMs, vitamin E, they say may help, B6 also, and very rarely tamoxifen may be used. But of course, you will give the treatment only after you have done a good triple assessment of the breast and cytology of the nipple discharge if it is an associated feature. So sometimes if the cyst is big, you can do cyst drainage also, and very, very rarely excision may be required. So this is the, flow diagram, how we approach a case of nipple discharge. If it is systemic cause, manage her after diagnostic evaluation. And sometimes she may need surgical nipple discharge. Usually unilateral conditions are there spontaneously. The nipple discharge is happening from a single or multiple lactiferous ducts. So if there is no suspicious lesion clinically or mammographically, then you can do central duct excision for patients who has significant nipple discharge from the multiple ducts. And if there is single lactiferous duct excision, you can remove that particular point, because you have to localize the trigger point and then treat her accordingly. But if the patient has underlying suspicious lesion, either you find it clinically or mammographically, you have to, of course, do excisional biopsy and manage. So if the breast cancer is there, you have to further, go on to modified radical mastectomy, or otherwise you can do breast conservation therapy if you diagnose these cases earlier. This is another flow chart, something similar, which includes, during the workup, this integrates ultrasound, mammography, breast MRI, etc. So this is breast abscess. We all know if the mastitis remains, untreated, it can become painful, lumpy swelling, and usually may be located deep. Mammography cannot be done because it will be painful, and it is a clinical diagnosis. Patient is having fever, chills, malaise. So you treat with good antibiotics and maybe repeated needle aspiration if there is collection. But one thing we have to be careful is, please rule out inflammatory breast carcinoma, especially during pregnancy. So this is multiple cysts. It can be done multiple times, needle aspirations. You can do them under ultrasound guided guidance also. So this is how you diagnose breast cancer. Because of lack of time, I will not deal much with it. So this was the case in which the cytology, there was a 75-year-old female with 6 months of pathological discharge from left nipple. Unfortunately, ultrasound diagnosed only duct ectasia. Mammography did not reveal anything. And cytology of discharge was done. It showed amorphous material, RBCs and macrophages. But no ductal cell was seen. Galactography was done for good visualization of the main duct. But there was no visualization of secondary ducts. There was a sudden cutoff. So they did a contrast enhanced subtracted axial MR, which is on the right side of the screen. It shows enhanced spiculated mass at the upper inner quadrant of left breast. And it was associated with a segmental non-mass enhancement. And at pathology, invasive ductal carcinoma was diagnosed, and there was extensive intraductal component also. So the moral of the story, I have presented these cases because sometimes ultrasound can miss. Ultrasound was done, but it missed. Similarly, mammography also showed no abnormal findings. But you have to be very, very, suspicious, especially in elder females. And she was, when properly investigated, we could diagnose invasive ductal carcinoma in this particular patient. So take-home messages are that nipple discharge, though physiological in most cases, has an underlying malignancy incidence of around 7 to 13%. What are the red flag signs? Unilateral discharge, discharge from single duct, bloody or clear, it may be clear discharge also, with or without a lump. And ultrasound and contrast enhanced MRI play a key role. Treatment is your treatment of underlying problem. Ductoscopy has largely benefited the evaluation because we can directly see and treat the cause of abnormal nipple discharge. Microdocectomy or vacuum aspiration are the surgical procedures in women with nipple discharge who wish to later breastfeed, because they are sometimes, they are somehow very conservative, approach, especially in women who want to have further children and who want to breastfeed their children further. So once again, requesting you for your blessings, vote and support for environmental health. Thank you so much. Let us all, promote breastfeeding, and let us all take care of our women so that we are able to diagnose, malignancy is the concern. So we can diagnose them early in time. So, and treatment is given to our clients. Thank you so much for the opportunity.
Charu, madam?
Yeah.
Yes.
Dr. Anita, you have very beautifully explained everything regarding. So, take home message according to Hari said, do not take nipple discharge lightly, whether it is clear or blood state, whatever, unilateral or bilateral. And do not delay any investigation. And ductoscopy has a good role. Thank you so much. Very well explained, and all the best for your tenure.
Thank you. Thank you. Thank you, dear friends. Thank you so much. Charu, your comments.
Yeah, I think, I remember the time when, I was not a part of the breast committee, and I really used to not understand as to how to treat these patients of discharge. And I really, feel so good that after working in this committee, we have the number of women that we have helped with breast problems is so immense that probably now, 10 to 15% of our OPD is, breast health and breast care. So I think that it is a very, very important topic. And unless you really start doing it, start working on it and start reading about it, it is not going to, come by. So this is a fantastic branch which we have handed over to the surgeons, and it is time we took it back, because it is not difficult at all. It is really, it is just finally a matter of practice. It's not rocket science, definitely. We are all so good at all our other procedures.
That
That
only
what is it to
operative
remove a
procedure ही तो
fibroadenoma?
है जो surgeons के पास है, तो we can combine that. बाकी हिस्सा तो अपने पास ही चाहिए.
Yeah, matlab, we understand that 80% of breast problems are benign, or more than 80% actually. So we should really, and as a committee, we are really taking efforts to promote breast health also. So I'm really glad that we have such amazing people in our committee who have taken this committee so forward, that now Dr. Jaideep Tang sir feels that it is time to expand the scope of our committee and include other things also, because he thinks we have now, exhausted everything in breast health. But I'm really, and Delhi is in the forefront as far as breast health is concerned. I have been to so many places now, but the meetings which Delhi DGF and AOGD conduct for breast health, they're really an eye-opener. And I really appreciate, all the efforts taken by all the esteemed faculty over there and everywhere for that matter, who have worked so hard in the field of breast health.
Thank you.
So I think one more important point is, that the younger generation, or overall itself, acidity is on an increase, and many of them take domperidone, and
Yes.
it is this medication which 100% will cause nipple discharge. So taking history regarding medications is very important, and the minute they stop the medication, they are much better as far as a nipple discharge.
And the anxiety level is so high. 4 days
yes.
back, only I had a 18-and-a-half-year-old adolescent girl. She was so worried. She was having bilateral nipple discharge. She was looking so anxious. I just asked whether you are on any drug or medication. Of course, the investigations will be done and further follow-up will be done. Anxiety level is very high. Reassurance of these patients and triple assessment, as very well highlighted. All these things become relevant. And we must all learn about VAB. This is one good technology.
Yes, VAB is really superb, the vacuum assisted biopsy. I think we will be having a talk in Pune, because we are having other procedures, or we have a big session on imaging modalities and newer techniques. So I'm sure VAB will be covered in that. So we are really going to have a great meeting in Pune with all these topics being covered. And I think that even if they come for any strange complaint of the breast, we should not miss out on the opportunity to subject them to some kind of screening if they fit in that particular age bracket. And we should make sure that we, usi bahane, they will undergo a sonography, or they will undergo mammography, because they are a little worried at that particular moment, and we can catch that particular, moment. And this time also, for all registered delegates, we are offering mammography at a discounted rate in Pune. So that is another thing that, wherever we have meetings all across the country, we should try for all the registered delegates at least to get some discounted rates for mammo. So they will go and do it themselves, because we neglect ourselves the most. And then once they get it done, maybe they will encourage their patients also to get it done. Thank you.
Thank you. Thank you for organizers for the opportunity. Thank you so much, Charu. Thank you, Meenakshi ma'am and Aarti ma'am. And lots of love to my breast committee friends.
Yes.
Thank you, Dr.
Thank
Anita.
you.
Hope you come up, Dr. Anita Rajoria.
Yes,
All
ma'am.
the
I am
best for
trying
your
my-
elections, and hope
Yes, ma'am. I'm
you
trying
from
my
all our
best.
heart and you and Minu win. Like.
Yeah, ma'am. Looking forward to meet all of you.
We are inviting you to Pune.
Thank you, ma'am. Thank you.
Thank you, ma'am. That was an excellent session. So we move ahead with the second talk of the day. This is going to be delivered by Dr. Mangala Vani. It's a very interesting topic, which is called Close the Gap. So I would like to invite our esteemed chairpersons for the same. I take the opportunity to introduce both the chairpersons. So Dr. Neerja Puranik Madam, she is an obstetrician gynecologist and a lactational consultant. She was the former HOD of Bombay Hospital, Indore. She has served as secretary and president of Indore OBGYN Society, president of Indian Menopause Society, Indore branch, treasurer AMPOG, city coordinator, assessor and life member of Breastfeeding Promotion Network of India, a member executive committee, MP state level monitoring cell for PCPNDT Act. She is an excellent vaginal surgeon. She has performed many live vaginal surgeries in various cities of India, especially NDVH. As chairperson of Rotary Rubella Vaccination Program, under her leadership, more than 70,000 girls were vaccinated. She has written many health-related literatures for public awareness, including books on breastfeeding, hysterectomy, menopause, menstrual health in Hindi, and different social organizations. She regularly delivers lectures on these issues. She's a recipient of many awards like Parshuram Award, Nari Shakti Award by Brijbhumi Foundation, Kamal Shakti Samman by BJP Mahila Mukti Morcha, Wonder Foxian Award in 2019, first award winning video in Foxy National Competition for Breastfeeding Promotion, and best paper presented in BreastCon 2018. Wow. So welcome, ma'am. Our second chairperson for the second session is Dr. Shilpa Shirsagar. She's from our very own Obstetrics and Gynec Society. She's a very active member and does a lot of social work. She's an associate professor at D.Y. Patil Medical College. She owns Shirsagar Motherhood Clinic at Wakad. She has special interest in high risk and social obstetrics, lactational consultancy, and adolescent health. She's an excellent writer. She takes online and offline sessions on women health, and she has received Women Par Excellence Award, Dr. Smita and Nayana Award. Welcome, ma'am. So I request both the chairpersons to carry on with the session.
Thank you, Dr. Madhura. Am I audible? Am I audible?
Yes, ma'am.
Yeah. Thank you, Dr. Madhura,
Yes,
for
ma'am.
nice introduction. And first, at the outset, I must thank Pune Obstetric Gynec Society, Madhura, and Meenakshi and Charu for giving me this great opportunity to chair the session, and that too on a subject which is so close to my heart, and that too on a speaker. She is a very good friend of mine. And Dr. Mangala is an obstetrician, gynecologist, and lactation consultant. She is director of Hirkani Gynecology and Breastfeeding Medicine Clinic in Pune. And she is past president of Breastfeeding Promotion Network of India. And she is past executive vice president, past treasurer, past clinical secretary of Pune Obstetric Society. And she is at present course director of IBCLC Lactation Training BPNI and national trainer for IYCF. And Dr. Shirodkar Oration, Sholapur OBGYN Society, she has been awarded. She is an Indian, she has been awarded as an Indian Achievers Award for Chikitsak Ratna by Global Society for Health and Education Growth, New Delhi. She is recipient of Young Scientist Award, Best Rebuttal Award, Dhanvantari Award, and NB Kumta Award. And I welcome my dear friend Mangala and for your great deliberation.
Yeah, thank you so much, Neerja, for such a kind words. First of all, I must thank you, POJS, though this is my second home actually.
but to be a part of this very prestigious webinar. Shall I start sharing my slide?
Yes, I think.
Can you see my slides? Can you see my slides?
Yes, ma'am. Please make it full screen.
Yes. Okay. So we'll skip over. So Anita, your talk was brilliant and really all the best for you.
Thank you, ma'am. Thank you so much.
So I am going to talk about this important topic, closing the gap and the breastfeeding support for all. Now, if you see, this is the World Breastfeeding Week, the first week of August, that is celebrated all over the world. And every year there is a different theme. And this week is why this week is celebrated to promote the breastfeeding. So whenever there are some deficiencies or what we can do to increase the success of the breastfeeding, so there is a theme. So this is to support the breastfeeding. Now, actually I cannot see for some reason the full slide. Can you all see the full slide? You can.
Yes, ma'am.
So, yeah. So actually, there are so many benefits of the breastfeeding. And still there is so much research has been there. It is still going on. But unfortunately, the breastfeeding rates remain stagnant for last 20 years. Too many children are missing out from this tremendous boost to their health and well-being. And so many women, they are not receiving the information or the support they need to breastfeed successfully. Now, if you see, it is a physiological. All mammals, they breastfeed their babies. We go to the colleges and give the lectures, and I specifically show these two pictures, which type of feeding you have seen. And 95% of the girls say they have seen only the bottle with the baby, and they haven't seen the breastfeeding. So if something which we have not seen, how we expect these girls in the future, when they become mother, they will breastfeed successfully. So, there is a support at all the levels. So there are 4 recommendations by World Health Organization and UNICEF. And they are very important recommendations, that initiation of the breastfeeding within first hour of life, but there has to be skin to skin contact after the delivery. Then exclusive breastfeeding from birth till the completion of the 6 months, and nothing else to the baby. No water, glucose water, formula, cow's milk, everything. Then after 6 months, we introduce the appropriate, fresh, hygienically prepared, homemade, mashed and soft complementary food. This morning only I went to one of the unprivileged area. It was a public awareness program. And what I thought, that they have so many myths about the breastfeeding and more so about the complementary feeding. And that is why there is so much malnourishment going on around. So it is important that we reach up to all parts of the population. And then the fourth is, and then along with the complementary feeding, we continue the breastfeeding at least till the baby's 2nd birthday, till the baby is 2-year-old, and converse and communicate while we are feeding the baby. Now, what is the situation in India? We have now institutional births has increased. It has become to nearly 89%. And if you see the breastfeeding within 1 hour after birth, it's only 41%. When we read or when we know initiation within 1 hour, it is so easy. But actually, practically, it is not happening. There are so many hurdles on there. So we have to improve the practices. The first 1,000, so important for baby's growth. It is most damaging and irreversible impact if the nutrition of the baby is not done properly. And that vicious circle goes across the generation. So this is just one shot, the breastfeeding, and lifelong benefits for the baby and for the mother as well. So if we inadequate breastfeeding, what happens? More than 100,000 under 5 deaths are prevented. You can see the figures, so many cases of diarrhea, pneumonia, obesity can be prevented in the children, or even the mothers are protected from breast cancer, ovarian cancer, and 875 crores rupees will be saved. So it is a huge impact on our Indian economy. This is a very important research from Lancet. Under 5, what measures to prevent the under 5 deaths. And if you see the yellow line in the bottom, that is the breastfeeding, and the red line is the complementary feeding, and that together more than 20% under 5 deaths can be prevented just by proper nutrition. Now, if you see the anthropological studies, the natural age of weaning was between 4 to 7. And fossil teeth reveals early humans breastfed for around 6 years. Because even many doctors, when I give lectures different places, and they say 2 years is too much. Once baby starts eating, 8 months, 9 months, they don't need the breast milk. But you should see amazing the benefits of the breastfeeding. So even if the WHO recommends breastfeeding for minimum 2 years, but maximum as long as the baby and the mother wants. So it could go to 2.5, 3, 4, 5 years. There is no limit. Of course, it is a natural. So the baby will automatically stop at one stage. It is not addiction or something for the baby. Now, there are so many reasons, mothers stop breastfeeding. But those all, if they get proper support, those barriers can be crossed, So if we see the breastfeeding, when the mother cannot breastfeed, she undergoes so many emotions. She's angry with the health professionals. She's anxious. When she grows also, later on also, she has a lot of regrets that she couldn't breastfeed. She's frustrated. So it is so important. Now, do you think that the breastfeeding is only woman's responsibility? She can just sit in one room and breastfeed and that's it. No, it is not like that. She cannot done alone. The success or failure of the breastfeeding should not be seen solely as the responsibility of the woman. Her ability to breastfeed is very much shaped by the support and the environment in which she lives. And there is a broader responsibility even from the government and the society and community, and of course we health professionals. Very important research paper from the Lancet in 2016. So if you see the support, you see this baby not happy because the support is not good for the mom and the baby. So where lies the responsibility? So it is at mainly 4 levels: at the policymakers, family and society, the employers, because more than 75-80% of the women go to work after delivery, few months after delivery. And of course, we all, the healthcare providers. Yes. So if you see the gaps, now if you see the theme, the gaps, in the breastfeeding, what are these gaps? That first is the aggressive marketing by the breast milk substitute companies. Then there is the insufficient training of the health professionals. So we can improve that by more coverage of this BPHI certification of the hospitals. There is the inadequate support at the workplace and the family and community support. So if you see this IMS Act, that is Infant Milk Substitute Act. So what is the role of the act? It protects the breastfeeding, because by this act, by controlling the marketing and promotional activities of the baby food manufacturers. So it regulates the production, supply and marketing. So by ensuring that it is proper use of the breast milk substitute and not that formula is prescribed for each baby and mother after the delivery, which is unfortunately still happens in many places. So it prohibits, this act that direct to the public, that no advertisement, and even the advertisement is done, it is done in a proper way, and there should not be pictures of the baby or even the animals on that dabba. No free samples given to the mother, no any free information given directly to the mother, and no inappropriate information that this product is really equal to the mother's milk. It is not like, you cannot compare the mother's milk and formula. You come to this conference and Dr. Prabhu sir, who is from the UNICEF, going to give important information on just these formulas, what it has and what the risk. So don't miss it. So even the health facility, we should not display at the counter or anywhere in the OPD about their information. And we should not take any gifts, no any sponsorship about the conference, research, fellowship funding. Breastfeeding week, they find so much opportunity. What they say, we have to do the breastfeeding activity, madam, and we will support it. See, they are there to do the business. Why they want to support the breastfeeding? But typically they give the pizza, they give the Coke, all that, and they do the promotional activity. But we should not be allowing to do that. So it is a multifaceted witch, and we fall for it. So what happens, the formula feeding, exposure to formula information, more likely to intend to use the formula, intend to use formula earlier, and less likely to initiate breastfeeding. And even if we give formula in the hospital, even the just few feeds, it doubles the risk of discontinuing breastfeeding. So we need to be so vigilant in the hospital practices. So look at those in formula companies. What they say to the company, we can assure the public our marketing policy is totally in harmony with promotion of breastfeeding. But at the same time, they are doing the business, and to shareholders, intensive promotion and advertising efforts brought about marketing improvement in the formula sales. So this is what they are two-faced. So next is the improving hospital practices, and that is baby-friendly designation. So BFHI, it is a global initiative, and but it is very, very low uptake presently in India. And WHO and UNICEF, they have put the 10 steps for the successful breastfeeding. And if we follow those 10 steps, then we get certification as a baby friendly. And with these 10 steps, its success of breastfeeding is higher. There is a lot of research. Because of my time constraint, I cannot show you in detail because these are all separate lectures to be given. So these are the 10 success steps for the successful breastfeeding. So if you see, it is a very busy slide, unfortunately. But the important thing, the first A is comply fully with the IMS Act, which we just heard earlier. You see the step 2, that ensure that staff has sufficient knowledge and competence and skills. Only knowledge is not enough. The skills, hands-on. Are we able to help the mother, for the latching and different things? And then clinical practice. Third is about conducting antenatal classes. The fourth is skin to skin and initiation within 1 hour. And the fifth, again, very important, support mothers to initiate and maintain the breastfeeding and manage common breastfeeding difficulties. And always the breast committee, we are always committed, to enlighten on those topics. Do not provide breastfeeding newborn any food. So exclusive breastfeeding means there is nothing else to be given to the baby. It is physiological. There is a lot of science. Even if the colostrum is small in amount, it is enough for baby. It does not cause hypoglycemia. And I'm talking this about the term babies, not premature babies. The seventh is rooming in together, the mother and baby. And then the support mothers to recognize the infant cues, early infant cues for the feeding. Then the counseling and for the use and the risk of the feeding bottles, teats and pacifiers. And the 10th is after discharge also, mother needs support. So most of the breastfeeding problems are caused by poor attachment of the baby to the breast. Thus, it is vital to learn how to feed the baby with correct positioning. Now, this is very important Facebook informal poll. And what the women, 50% of the said they never saw the breastfeeding, not as a kid, not in the normal day-to-day activity, not even on the TV. So that is what I earlier said. If we haven't seen that earlier, how we expect to do it? Now, this picture of the gorilla and the baby, this is from one of the zoo in US. There, with the new administration and all, they started feeding the babies with the bottle, and that interfere with the breastfeeding. So what happened? This gorilla stopped babies breastfeeding. When the local ladies, they came to know that in the zoo now these animals are not breastfeeding, they actually, few ladies, they came with the small babies and they sat in front of these gorillas and breastfed their babies. And when the gorillas saw that, they realized, and they took their baby and started doing the same, and the breastfeeding started again. So this is what important in our community also. Sometimes I see the mothers, they sit in the room, even the elder child, they don't allow inside. That is not right. From the childhood, you know, the samskar on the children also, that the baby's food is there at the mother's breast. So this is the 4 basic points, maximum possible areola. And that is maximum. We should not say all areola, because areolas in different mothers are different sizes and shapes. So maximum, because babies also, mouth capacity is different in every baby. Mouth wide open, lower lip turn outwards, and chin touching the breast. And these are the different positions, but I'm not going to go into detail. But see the important, the baby should be turned completely towards mother. So see, sometimes the mothers, you know, they are not concentrating on breastfeeding. There is no communication. She may be watching the television or having argument with the husband. We don't know. But you know, the breastfeeding doesn't go like that. So counseling of the mothers is so important. We have to teach every mother how to express the milk. You know, because initially the latching may not be successful. Then the baby gets colostrum. When she gets engorgement, that will be relieved. You know, softens the breast so that the baby can latch on the breast. And it, of course, protects and improves the milk supply. So if we teach her how to express when the baby is particularly separated, you know, she can massage and she can express. We even with the 2cc syringe, we just collect the colostrum or in the small spoon, and then the parents, they feed the baby in the NICU. So these are the small things that we have to follow in the hospital. So BPNI Maharashtra, where I was a president for last 8 years, we do visit the hospitals and we do the training and we do all the situation, what is happening, and then we ask them to improve the practices and we certify them for the BFHI. So anybody is interested, they can always contact us. So support at workplace, as I said, the women are going to work. So the time, space and support. Space is what? At work, there has to be separate room where mother can express the milk 3 hourly. There has to be table, the chair, the freeze where she can store the milk, the water, the basin where she can wash the hand or the bottles, whatever. Plus her time should not be counted as off. That should be included in the work. And the support, you know, from everybody, from the boss. Because one of the mother recently, she came, that her child is 1 year, and when she's expressing the milk at work, the colleagues are laughing. Your baby is now 1 year old. You should stop now this. What is this nonsense? So, you know, even she's coming to me from the pregnancy, from the beginning, still that is the case with her. So you can imagine what happens generally. So very, very important. And the maternity leave benefit, 6 months maternity leave. So after delivery, even before delivery, whatever leave she has, that should not be included into the maternity leave. So that is very important. Even the fathers, the paternity leave is also important. So family support is extremely important. And I find the father particularly, you know, because if he is there all the time with mother, the chances of successful breastfeeding increases. He can give emotional support, technical support. Even, when we teach the mother and husband is there, he actually learns the things better. He can even support the baby's neck properly if we teach them. And he can bring the mother the food. He can change the nappy or give bath or look after the baby for a few hours. And communicating his mother. This is the now question again between mother-in-law and daughter-in-law. So she cannot sometimes say directly to the mother-in-law, I want to eat this, or give me hot cup of tea, or if she's putting some kajal, don't put the kajal in the baby's eyes. So it is important that the father tells the mother nicely, what is happening. And best way is to bring the family for the antenatal classes. Now, all mother-in-laws are not bad. I'm not saying that. I myself, I'm a mother-in-law. And recently, my son and my daughter, they have babies. So what I liked good is when I was there in UK with them and my time has come to come back, my daughter-in-law said, we have thrown your passport in the river. That means what? Please don't go. So I feel good at it, that she is comfortable with me. And I'm sure all mother-in-laws, they can do the good role like that. So all family members can give the good support. But we have to watch out. There can be negativity between the relation. There are a lot of myths. They can give the formula feeding without the knowledge of the mother. Inappropriate complementary feeding. And there are so many myths. The initiation, they said no, if the colostrum is not good, or let somebody come and first put some mantra in the baby's ears, then only we give the breastfeeding, or they bring the honey, they give the pre-lacteal feeds. Baby cry means hungry. There are so many other reasons baby cries, and breastfeeding only in sitting position. Actually, when the lying down position also mother can breastfeed beautifully. Not breastfeeding in public. Again, that is another topic. The educated mothers, when they go to the restaurant, they eat their food, but they don't feed the baby. They bring the bottle along. So we have to change all this. Stopping breastfeeding early, as I gave the example earlier on. The baby care, so many wrong practices, and preference for a male child. Now, this is a very viral photo. And you see, this is the Pakistani lady who delivered the twins. They were little preterms, but they both were kind of equal. But you can see the one is breastfeeding and the other has the bottle feeding. And the breastfeeding one is the male child, and the one who has the bottle, family said, because they thought she can breastfeed only one child, enough milk. So only male child received the breast milk and the female child received the upar ka doodh. So obviously it was not done properly. It was so malnourished and it died at the end, So this is what the family. Again, induction of the lactation, when there is no milk or when she's not pregnant, we can induce the milk in her. But again, they need a family support. Because if the family doesn't believe and they don't support, it will be very difficult for the mother. Support in the community is equally important. We can have mother-to-mother support group, lactation clinics, very important. There are online forums also. The lactation clinic, the breastfeeding clinic, very, very important. Now, Pune, there are few breastfeeding clinics are coming up. We have started it 20 years ago. And lot of girls, mothers, they come with the breastfeeding problems. In the community spaces, in the malls, in the cinemas, airports. But I do see now a lot of places where they do give the space for the breastfeeding. Even in the school, the children has to be sensitized. Now, there was a memo in one of the office in UK. Effective it was just outside the door. Effective immediately, room 306 is no longer designated smoking room. We are pleased to announce that room 306 is now designated the official breastfeeding room. Isn't that amazing? So that awareness we need in society. We also conduct this IBCLC course, which is a master's course in the lactation. And as mentioned earlier, that we have this conference, Breast Health and Lactation Summit in Pune at Hyatt Regency for 2 days. Wonderful scientific program, wonderful food, and you will see so many speakers, national speakers. So don't miss it. So again, working together at all levels is very, very important. Thank you so much.
Thank you, Mangala, for your wonderful, as always, wonderful deliberation. And it is coming right from your heart. And you are working so hard for it for such a long years. And it's very important to observe this golden 1 hour opportunity. And we as an obstetrician, how many of us are doing it? We should look into our perspective, and we should encourage each and every obstetrician to go for golden hour opportunity. We are just taking the baby out and then weighing it and then giving the vitamin K and changing the clothes and giving baby to the relatives, showing, and we are just wasting time. So it is our humble request to all the obstetricians attending here to observe the golden hour. And as Mangala said, that whenever we go for the rounds, our nursing staff and all other paramedics, they scold the mothers to sit and then to feed. The कान में दूध चला जाएगा, बच्चे को स्मॉडलिंग वो हो जाएगा, smothering हो जाएगा. This is all myth and misconception. So we should encourage at least for 6 weeks, first 6 weeks, we should encourage mothers to be lying down, to feed the baby in lying down position. और उसके बाद तो बच्चा शीर्षासन करके भी कोई भी पोजीशन में फीड कर लेगा. But these are the golden time when we should give time to mother and baby both. उन दोनों को sort out करने देना चाहिए, और जितना maximum skin to skin contact lying down में होता है, उतना किसी में नहीं होता. तो lying down position should be encouraged by we the obstetrician. The sitting on a painful episiotomy wound is so difficult in middle of the night, and sitting on a painful abdominal wound also is so difficult. So lying down position and first golden hour observation is, these are the 2 main points which should be a take home message for today's seminar, that we should encourage this, and so the we can improve the breastfeeding incidence of breastfeeding. Like the we want that 84%, as Mangala has said, of the deliveries are going on in the hospital, and only 40%. It is so shameful that only 40% of them are receiving the golden hour opportunity. And I always say to my mothers that the real mother is your breastfeeding, and the putana is what? The bottle feeding, and the formula feeding is putana, who has come to kill your child. So thank you, Mangala, and thank you, POG, for giving me this opportunity to chair the session. Yeah.
It is environment friendly also.
Yeah, very much.
Very important, Amita, that you said.
She has come up with that slide that
Amazing
so
that
many
is.
expenditures for
मतलब अगर हम
formula
देखें
feed.
कि फॉर्मूला फीड बनाने के लिए कितनी फैक्ट्रीज में काम होता है, रॉ मटेरियल आता है, ट्रांसपोर्टेशन में इतना फ्यूल होता है, कार्बन प्रिंटिंग बढ़ती है ना, और फिर उसको डिस्ट्रीब्यूट करने में उसका भी कार्बन प्रिंट अलग है, फ्यूल है, ग्रीन हाउस इफेक्ट है. लेकिन breast milk is so fresh, natural and healthy, of course. And one more thing, ma'am, whenever there are environmental disasters, na, they say that the babies who are breastfed, they will survive.
Yes.
They will survive because it gives them more.
Yes.
और ऐसे में हेलीकॉप्टर से बेबी फूड डिलीवर करते हैं, दैट इज ऑल्सो सो डेंजरस. वो भी नहीं करना चाहिए. दैट इज ऑल्सो अगेंस्ट द IMS एक्ट. और वी शुड बी अवेयर. हमारे यहाँ इंदौर जू में ऐसा हुआ था कि दे वर ओपनिंग अ बेबी फीडिंग रूम. So they invited me that, madam, we are only 2 days are left, and you can just see the room that we are opening, this baby feeding room. So I just went there and saw the mother was feeding the baby with a bottle. So I got so annoyed कि तुम बेबी फूड की वो इनॉग्रेशन कर रहे हो और उसमें मदर को दे रहे हो कि वो मैडम हमारी कमेटी में तो बहुत सारे डॉक्टर्स हैं, nobody objected, nobody sees at that angle. So I asked who is the painter. Then I contacted painter. Painter ने बोला अब 2 ही दिन बाकी हैं, अब हम कुछ नहीं कर सकते. Then I contacted another painter और उसको एक्स्ट्रा बोले मैडम इसमें तो बहुत पैसे लग जाएंगे. मैंने कहा I will pay for it. You just change this photo.
So that is what, there is so much talk on different aspects.
Yeah,
And that is why we arrange, POGS always organize the conference, full conference. So many topics are covered. So please, all of you, you are there as a faculty, I know, but you encourage your colleagues also to come and attend this conference.
My daughter has just delivered in Canada और वो तो इतनी ब्रेस्ट फीडिंग पूरा उसका बचपन से उसने देखा है. तो यहाँ पे एक स्टेडियम में she was breastfeeding her baby and in open and one of the lady said where is your cover? आप कवर क्यों नहीं कर रही हो? तो बोले कि मैं आपको शर्म आ रही है तो आप कवर करो, मुझे कोई शर्म नहीं है पब्लिक में ब्रेस्ट फीड कराने के. And I am not going to cover the face of my baby. Can you cover your face and then eat the food? She scolded her.
That's a very nice concept, Dr. Neerja. Yeah, it's encouraging also.
Yeah.
Yeah. It
Dr.
will be
Neerja,
encouraging to other people. I think what Dr. Mangala had focused in her PPT, that nowadays girls don't see breastfeeding procedures. I mean, what are the process? Because they are all kept done in so much secrecy. Why not in public? Why not in open? Like all others should be able to see, especially the young girls. They should see their elders breastfeeding their, young
Absolutely.
then only the breastfeeding concept will revive. Actually, it was there in our community. It was there in our Sanskruti so many years back. But
And
now it has declined.
Every 3 months, I am conducting seminars with husband, mother-in-law, and mother, and each and every one of the family. And those ayabais who come from Calcutta, they are very knowledgeable person. और वो इतना गलत बताती हैं जो बच्चे को रखती हैं. So my granddaughter, she is only 13-year-old, and she always comes in the seminar to have samosa. मेरे को समोसा खाना है, and then she listens. मैंने कहा तू समोसा खिलाऊंगी पर तुझे सुनना पड़ेगा. She listens and then eats samosa.
Yeah, and the breast, in the society is focused as a sex organ. Not
मंगला मैडम, हाँ, इससे मुझे याद आया, मैं एक बार यूरोप में थी and we were on that rope thing, climbing on that rope thing, sitting, and there was this beautiful lady and we were standing because you had to stand, and she was standing only, she was feeding her child.
Yes.
And nobody was looking at her, and I was saying ये इंडिया में कब आएगा ऐसा कि यूरोप में एक ब्यूटीफुल लेडी आराम से अपना ब्रेस्ट फीड कर रही है. They were men and women and no one was looking at her, and it was not awkward for them at all. And I felt that this kind of thing should also be
welcome. We all of us are there now. Everybody is doing the work. So things are changing.
Yes, we should keep a positive outlook. Even when we had gone to South Korea, we had taken out a POGA South Korea tour. We remember on Nami Island, there's a huge statue of female breasts, and female breasts are shown like rivers. So the small boy stands in front of them, and there's a quote written down, ki these breasts are my rivers of nourishment.
Yeah,
so nice. You have taken the photo?
Yeah, we have taken the photo. I'll send it to you.
And it was a big statue of the breastfeeding
mother. Mother's breast and a tiny toddler standing in between the two breasts.
Yeah.
And saying that these are my rivers of nourishment.
Yeah. Lovely.
Very nice.
Thank you, sir. Thank you, Mangla.
Thank you very much, yes, again, and for being here for this webinar. Thank you, Anita madam, and wish you all the best for your
Thank you, ma'am. Same to you, ma'am.
Thank you very much. Thank you.
Shilpa
Thank
wants to give her comments. Dr. Shilpa, or she spoke?
No, I did not speak, but it was really excellent talk, and obviously both are the stalwarts, Dr. Anita ma'am and Mangalavani ma'am, as we all know, and they are really inspiration for us, and both the talks were very useful and covered the topic comprehensively, and thank you so much for this opportunity. I could hear, it was a feast to listen both of them. Really, thank you very much. With this, I'm quite junior to you, as ma'am shared her experience that her daughter was feeding in the public. Similarly, my 13-year-old son, yesterday he explained me about breast all. So I was like, how to know about breast? Then he said, many of the times you are only saying breast crawl and everything, because nowadays, because of breastfeeding week, we are into that only. Then he said, I developed interest what exactly it is. Then he watched the video and read on the Google also. So as ma'am said, I feel with this small activities, even the children's attitude towards seeing breast as only the sex organ will change, and probably that will bring a greater change, not only for the breastfeeding, but in general respecting women becomes a part of their journey if they look at the breastfeeding as a important part of life. Thank you very much.
Family support is very important. Once I was traveling with my father, I had a neonate in my arms. So it takes around 3 hours to travel from from Delhi to my native place. So my father told me, "Beta, you don't feel ashamed. Just feed your baby. Your baby is hungry, and you should not feel awkward in feeding your baby." The same, this family support is very, very important. I was having a hitch whether to feed the baby or not, but he said, "No, no, beta, you should feed. Your baby is hungry. You should feed." And
So
once
nice of him.
yeah, even my brother once said, "Didi, everything is all right. You became pregnant, you delivered, you had a baby. Everything looked so good." But because of our culture and all that, one feels awkward when you see your sister feeding and all that. It may be because we are like this, we are brought up like this. So we have to change our mindset, and this is something which is great. It is I think it is divine. So that divinity should be there in breastfeeding.
With permission of Charu, I will share my poem, which I have received a first prize, and I will share the poem in faculty this thing, if you permit.
Sure, sure. So thank you very much. I take the privilege of, giving vote of thanks now to all the esteemed faculties and all the chairpersons. Of course, guest of honor, Dr. Charu Bapaye. Thank you so much for doing this program and arranging all the guest of honors, the speakers and the topics. And thank you to the chairpersons and also to the speakers, Dr. Anita Rajouri and Dr. Mangalavani. And of course, the MOC, Dr. Madhura Kelkar today. And of course, the BSV for giving us the platform. So thank you so much. Let's hope we'll meet again next when in the coming Saturday, Sunday conference in Pune. Welcome. And heartiest welcome to all of you.
Thank you for all the... Yes, ma'am. Thank you. Ma'am, you are muted.
Madhura Charu.
Minu, you are muted.
डॉक्टर शिल्पा, आपके कॉलेज में सबने वोटिंग किया है या नहीं किया है? प्लीज 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 चेक करके और सब वोटिंग करा के ले लो। नहीं की तो सिंपल है। अगर कुछ भी प्रॉब्लम है, यू गिव मी अ कॉल और यू मैसेज मी, I will send you a link where you can create a link. If you have not received a link, so you just send me a message. I will send you the common link from where you can create your own link. So if there is any difficulty,
sure.
But have you voted? Yes. Could you vote?
Okay. No, I myself have not yet. I will do it.
So वही मैं बोल रही थी अभी. You just go on your text message or on your mailbox. There will be a message or mail from ePoll, EPOLL, and there is a link. Just in case you are not got the mail or the message, you message me. I will send you a common link which will create a link for you. And it not take less than 1 minute. Madam, I could vote in less than 1 minute. She was feeling so, as if she's achieved something. She said, "I thought I'll need somebody to help."
Actually, very easy.
I will do it right now, ma'am. As soon as I log out, I will first do that.
और मुझे मैसेज कर दो आपने वोट कर दिया करके, है ना?
Yes,
एक
yes, surely.
yes, yes, yes.
Okay,
Okay,
okay.
okay.
Thank you, ma'am.
Late
Thank you.
meeting
Thank
all of you, ma'am. Thank you.
Nirja madam, thank you.
Thank you,
Thank you,
everybody.
ma'am.
Pleasure
Thank
meeting
you so
all my lovely members. Thank you,
Thank you,
Meenu. Thanks
Charu.
to you.
Thank you, Charu. Such a
Thank you,
short
Charu.
notice and yeah, very beautiful program. One of the best programs that
Actually,
we
very
have.
nice. Very nice.
Manjula madam, बहुत
Thank you
अच्छा,
so
very
much,
nice.
ma'am. Thank you so much.
Madhura, thanks a ton.
Thank you. My pleasure.
Thank you. Thank you so much.
Thank you. Thank you, Press Committee and POGs. Thank you.
चलो मंगल आपण 2 मिनिटं थांबूया.
Okay.